Baricitinib is a Janus kinase JAK inhibitor that has been primarily used for the treatment of rheumatoid arthritis and COVID-19 related inflammatory responses. Its use in psoriatic arthritis, PsA, is of interest due to its mechanism of action, which targets cytokine signaling pathways involved in inflammation and immune responses. Clinical efficacy in psoriatic arthritis. 1. Mechanism of action. Baricitinib selectively inhibits JAK1 and JK2, leading to a reduction in the signaling of various pro-inflammatory cytokines such as IL-6, IL-12, and IL-23, which are involved in the pathogenesis of PsA. 2. Clinical trials and data. Although baricitinib has shown efficacy in rheumatoid arthritis, its role in psoriatic arthritis is still under investigation. Clinical trials are assessing its safety and efficacy in PsA patients, focusing on joint and skin symptoms, dactylitis, enthesitis, and overall disease activity. A phase 2 study, NCT-034995, evaluated baricitinib in PsA and demonstrated improvements in the signs and symptoms of the disease, but further studies are required to confirm these findings and to compare its effectiveness with other treatments like TNF inhibitors, IL-17, or IL-23 inhibitors. 3. Safety profile. The safety profile of baricitinib in PsA appears to be consistent with that observed in rheumatoid arthritis, including risks of infections, particularly upper respiratory tract infections, blood clots, liver enzyme elevations, and lipid changes. Considerations. Current positioning. Baricitinib is not yet a first-line treatment for psoriatic arthritis and is considered more of an investigational or off-label option. Other JAK inhibitors like tofacitinib have received more attention in PsA treatment, and baricitinib may follow similar patterns if ongoing studies yield positive results. Patient selection. Potential use might be considered in PsA patients who are not responding adequately to conventional DMARDs or biologics, but careful patient selection is necessary due to the associated risks. If you're considering this for clinical use or research, monitoring emerging data from ongoing clinical trials will be important.